morning, everyone. I'm Jacopo Imberti from Modena, Italy, and today we will discuss a new EHRA scientific document on same-day discharge after EP or CIED's procedure, just released in EP Europace. Let me introduce our guests, Maria Frausing from Denmark, the coordinator of this document, Professor Daniel Scherr from Austria, the chair of this document, and Julia Vogler from Germany, the co-chair of this document. Thank you very much for being here today.
Thank you.
So before we dive into the technical aspects of this document, Daniel, why was it important to develop this document at this specific point in time?
Well, thank you, Jacob. I think the clinical consensus document developed by EHRA and ACNAP for same-day discharge procedures in electrophysiology and in device implantation is important on various fronts and for various reasons. First of all, and this is the spirit of the document, for practical reasons. People are performing same-day discharge procedures in an increasing amount, and it is important to give these people and also physicians who want to start with same-day discharge some practical guidance. And this is what this consensus document is for. And to stay in that spirit, we tried to keep the document science-based, but as practical as possible. Reason two is that the number of procedures we perform, slightly in the device arena, but increasingly in the ablation arena, is massively increasing, and this puts constraints on hospitals. You know, some systems are struggling with the number of hospital beds, waiting lists are increasing, and while this may not be the main reason to do same-day discharge procedures, it may be one of the reasons to do it. So again, another reason for the document. Let me finish up with the third one that I think is very important. Our procedures, you know, we always have to stay humble, focus on safety first, focus on efficacy, but also procedure times across the board are decreasing. You know, there is an option to go same-day discharge versus overnight stay, and you know, patients increasingly also demand same-day discharge. Very final word, it is important that we don't mandate same-day discharge procedures for any indication. It should remain an option. This document does not advocate same-day discharge. It puts it into the scientific perspective and gives practical advice.
Thank you, Daniel. You touched many points which are very important, and we will go through them during the interview. But Maria, can you explain to our audience how do we define same-day discharge and how do we define overnight stay, please?
Yes, this is an important aspect for who this document applies to. So we define same-day discharge as the scenario when a patient presents for either an EP or CIED procedure, undergoes the procedure, and is discharged on the same day, so without an overnight stay. So all the scenarios where the patient stays overnight either presents on the day before or presents on the day of the procedure and stays until the next day, we define as overnight stay.
Thank you for clarifying this aspect. Julia, one of my main concerns when I read this document was about safety. So is it safe to perform same-day discharge in all EP procedure and all CIED's procedure?
So this is a very important point, as it is one of the main reasons for restrictions for same-day discharge, which holds some physicians back for performing same-day discharge. So based on the current evidence that we have, although it's primarily observational and some RCTs, we can state that an appropriately selected patient same-day discharge can be safely performed. So there are for sure procedures that are not ideal to perform for STD. For example, for the CIED procedures, transvenous lead extraction is one of the procedures which has the highest peri-procedural risk. So these are patients which are not eligible for same-day discharge, but which are also not part of the definition of the patients that would be eligible for same-day discharge. But most of the procedures are eligible. For EP procedures, for example, most of the VT ablations will not be possible to be performed as same-day discharge, as many of these patients are also admitted as urgent or emergent cases.
Yeah. So there are exceptions, but for most EP procedure and CIED's procedure, we can say that they are safe, such as AF ablation can be performed on a same-day discharge. What do you think about that?
Yes, I think so. So for EP procedures, I mean, AF ablations are AF ablation is the procedure that is being performed in most labs, or is the primary procedure that is being performed. So for AF ablation, we have the most evidence, and it's can be safely performed in those patients. And in principle, nearly all CIED procedures can be performed as same-day discharge in appropriately selected patients. There are some exceptions, but for most patients it is possible.
Thanks. And you mentioned the appropriate selection of patients. Daniel, how do you define the patient which is suitable for same-day discharge? Do you apply protocols? What kind of clinical factors do you look at?
So I really like your question, because you point to the way we look at patients and define patients. It's mainly clinical factors. And obviously, besides the indications that have been mentioned by Julia, there are some clinical cofactors that disfavor same-day discharge procedures, and which are somewhat evidence-based, like advanced renal disease, advanced pulmonary obstructive disease, high BMI, advanced heart failure, other factors, a previous complication at a previous procedure. But very much when you start designing such a document or designing a same-day discharge pathway in your hospital, you find out that it's about the clinical factors, but also very much about the social factors. Of course, like with every procedure and every pathway, you need the patient on board, you need his or her consent. But also, just to give you two examples, same-day discharge is primarily not addressed at people that live by themselves and don't have somebody with them in the first 24 hours after the procedure. This can be temporary, just for the time after the procedure, but there should be, somebody accompanying the patient, or a distance we defined in the document, of 50 kilometers or more away from a hospital setting. If you need then immediate medical contact, you should have, the apparent logistical structure to follow up. Those are part of the social cofactors that you need to consider.
This is very important. Sometimes we underlook at this aspect, so the social context, but it plays a major role. And Maria, are there any mandatory checks that you perform on the patient before you can say, okay, you can safely go home on the same day?
Well, I think we proposed a setup that you might consider when you want to proceed with same-day discharge. And I think much of the setup is the pre-procedural assessment, which is ideally taking care of the same day. And this is the day where you should assess these different factors that Daniel also mentioned. So the patient-related factors, the social factors, and also the patient consent and shared decision making can be performed this day. And I think it's important also to mention that this document specifically addresses elective CIED and EP procedures.
Yeah,
that's a good point.
Of course. But when, from a practical point of view, when you're in the ward and you are about to discharge this patient, what do you look at? Do you look at correct hemostasis? Do you routinely perform an echocardiogram, an ECG, or not?
So I think for the post-procedural care, It's important to have a specific monitoring time because the aim or the goal of this monitoring time is to rule out acute complications. This is the ones we fear the most. And then for EP procedures, you should perform an ECG. You should an echocardiogram. We discussed this a lot. It's so we didn't put it as a mandatory one because there are countries we learned that do not perform echoes on a mandatory base. So we think it's a very cheap exam, and which is very safe to perform, so we would also go for an echo. But if you don't perform that, you can also stick with your practice. So an ECG and echocardiogram check the vascular access site, because this is the most common complication in EP procedures, and there should be an instruction for the patient. So if he passed all these checks, he can be safely discharged. And for the CIED procedures, you should check the pocket, you should do the interrogation, and if the patient is included in remote monitoring, you should have a setup when to include the patient in the remote monitoring and give him instruction as well. So if they have passed all these checkups, they can be discharged with a discharge checklist as well.
Thanks. That was very practical, and also you mentioned the follow-up. So you already have to plan a little bit in advance the follow-up of this patient, maybe through telechecks or remote monitoring, whatever. But this is something that we need to keep in mind. Daniel, I would like a final word from you. So in Europe, figures about same-day discharge are quite low. I mean, there are a lot of patients which are suitable for the same-day discharge, but it's not really well implemented. How do you see the current practice, and how do you see the evolution of same-day discharge? Are we going to apply it on, let's say, the vast majority of our procedure, or are there some barriers that we have to still overcome?
Well, my message here is very clear. I mean, wherever you practice, and if you do implantation, ablations, or both, just take care of the patient in the best possible way that your setting allows. For some countries, for reimbursement issues, or for the matter that enough overnight stay capacity is available, same-day discharge is not an option. And if this is your setting, fine. We are not advocating to transfer to same-day discharge. We are just showing options. That's number one. Number two, if you look, I think in those times we all know that not everything that is coming from the United States is necessarily good. A lot is, but not everything. But if you look at the trends there, COVID was really a game changer. And as of 2025, 60% of all EP and or CIED procedures in the United States are performed on a same-day discharge basis. So this shows you that in which direction, I would say, in the Western world the trend is going. And number three, I think if you would reduce this whole interview to one message, at least from my side, then it would be, if you're about to start, and I think more and more people will start, turn to our document, but also think about it as an holistic approach. It is not a physician-based approach. Before you start, plan well and plan with the team. Think about a same-day discharge coordinator. Think about how this plays well not only for you, the hero in the lab or in the implantation, but also talk rigorously to the people on the board. Just try to get everybody on board. It is about the procedure, but it is much more about all the other aspects around it.
Thank you, Daniel. This was very insightful. I think it's now time to close this session. It was a really nice conversation, and I think this document will really change our clinical practice. Thank you for staying with us, and enjoy the rest of the Congress.